Hello, my name is Wayne, and Anthony and I did our project on comparing the occurrence of phantom limb pain in adult patients undergoing limb amputation when receiving general anesthesia versus regional anesthesia.
Limb amputation procedures are a very common surgical case performed in the United States, with over 400,000 occurring yearly. A common but unfortunate adverse event of limb amputation is phantom limb pain, which can be described as a neuropathic sensation that has a wide range of severity from moderate to mild discomfort to severe pain. Once a patient contracts phantom limb pain, it is very difficult to treat. Further, the incidence of phantom limb pain is very high at 88%. Originally discovered in the 1500s and described by Ambrose, the exact cause is unknown. However, what is known are risk factors, which are smoking, pre-amputation pain, and the anesthetic method. For this presentation, the anesthetic options between general anesthesia and regional anesthesia are compared to assess their impact on a patient's risk of developing phantom limb pain. In order to best understand this concept, it can be useful to use relevant literature and identify a related theory. In this instance, the gate control theory can be applied, which suggests that pain is influenced by how pain signals are managed in the central nervous system. By using this framework, different anesthesia techniques and how they impact phantom limb pain can be studied. The anesthesia options for limb amputation include general and regional, which make up peripheral nerve blocks, spinals, and epidurals. And again, this choice of anesthesia may impact the occurrence of postoperative phantom limb pain. Problem statement and objective. The significance of this topic is that phantom limb pain has a very high occurrence rate, with greater than 50%. In fact, phantom limb pain affects 60 to 85% of amputees, and the treatment options or methods that can be done to reduce phantom limb pain are crucial in order to improve a patient's quality of life. Therefore, this project aims to conduct a literature review and evaluate the impacts of anesthetic technique. During the literature review, my partner and I created criteria of inclusion and exclusion in the studies we reviewed. Participants were greater than 18 years old and underwent limb amputation. The intervention was comparing general anesthesia, which can be inhalation agents, also known as volatile anesthetics, global anesthesia, also known as total intravenous anesthesia, compared to regional anesthesia, which involves the use of local anesthetics, either in neuraxial technique, such as spinals, epidurals, peripheral nerve blocks, localized numbness, and targeted anesthesia. The occurrence was identified by the intensity, the duration, and assessed using rating scales, diagnostic codes, and questionnaires. These studies were all English journals from 2006 to 2023, and a variety of studies were included, such as retrospective cohorts, observational, cross-sectional, and finally, if patients were less than 17 years old, if the study was not in English, or if there was no focus on anesthetic technique. This was considered exclusion criteria. The search strategy began using peer-reviewed journals from 2006 to 2023 from Central, CINAHL, Embase, Medline, ScienceDirect, and ProQuest. My partner and I then used search terms such as limb severance and limb amputation, and using search terms for the intervention, comparison, and outcome. We also used Boolean phrases or equivalent terms. The search was limited to only scholarly, peer-reviewed journals in the English language from 2006 to 2023. This search was conducted by my partner and I, who are both doctoral nurse anesthesia students at Franciscan Missionary of Our Lady University. We then utilized the help of an expert with research, our university librarian. Our initial search resulted in 260 articles. We removed 30 and ended up with a total of 230 articles for exclusion and inclusion. And finally, Zotero was used in order to organize our data.
Literature selection. To initiate the inclusion and exclusion criteria, a Prisma flow diagram was utilized as a framework to systematically arrange the search results and pinpoint potential articles. 260 articles were identified, 30 duplicate records were removed. Therefore, 230 articles underwent title/abstract screening. Of these articles, 9 articles remained to undergo full text screening. Of these, 3 articles were excluded. A Joanna Briggs Institute critical appraisal checklist was completed for the remaining articles. Ultimately, this process yielded 5 relevant articles to be included in the systematic review. Results and discussion. 5 articles were included in this review, all of which investigated phantom limb pain and its correlation with the type of anesthesia administered. The identified theme was anesthetic techniques and presence of phantom limb pain. Studies originated from India, Korea, Canada, and Turkey. Types of studies included retrospective cohort, observational, and cross-sectional studies. The results from these studies show that the prevalence of phantom limb pain was decreased when neuraxial anesthesia or peripheral nerve blocks were used rather than general anesthesia. These results were prominent, especially in the first week after amputation. However, studies did show that anesthetic technique may have no effect on phantom limb pain greater than 14 to 17 months post-amputation. Authors' conclusions. Studies collectively favor neuraxial anesthesia and peripheral nerve block over general anesthesia for managing immediate post-op pain. Neuraxial anesthesia and peripheral nerve block potentially reduce occurrence and intensity of phantom limb pain, especially in the first week post-amputation. Therefore, healthcare providers should consider regional anesthesia for lower limb amputees in the absence of contraindications. Limitations, strengths, and challenges. Limitations include lack of clarification regarding technique used for general anesthesia. For example, the articles did not mention whether inhalational anesthesia was used in combination with IV anesthesia or if there were instances of solely IV anesthesia being used for their general anesthetic technique. Also, there was variation in sample size and selection. Additionally, there were differences in duration of follow-up. Also, limitations include reliance on patients' recall of phantom pain that could contribute to recall bias. And lastly, there's potential for cultural and healthcare variations as the studies were from 4 different countries. Strengths include the diversity of studies, thorough examination of anesthetic modalities, including general anesthesia, neuraxial anesthesia, and peripheral nerve blocks. Also, exploration of additional risk factors such as diabetes and traumatic amputations. Those could contribute to phantom limb pain, and those were addressed as well. Challenges include studies collectively stress the need for further research using more rigorous study designs, such as randomized controlled trials and cohort studies. Authors' recommendations. Overall, these studies demonstrated neuraxial anesthesia and peripheral nerve blocks resulted in better outcomes over general anesthesia for managing immediate post-op pain. However, it is important to note that these findings may not conclusively address the question regarding how anesthetic technique impacts the occurrence of phantom limb pain in a long-term post-op period. Therefore, more consistent study methodologies that include data from both the immediate and long-term periods are required to provide a more definitive response to the PICO question. Implications for practice. Regional anesthesia should be considered for patients undergoing limb amputation. Evidence suggests reduced phantom limb pain incidence in amputees treated with neuraxial anesthesia and peripheral nerve blocks when compared to general anesthesia. Amputees recalled reduced phantom limb pain in the immediate post-op period and in the week post-amputation. Additionally, regional anesthesia may help to prevent cortical reorganization, thus decreasing the occurrence and intensity of phantom limb pain. However, more studies are needed to determine the long-term benefits of anesthetic technique and the occurrence of phantom limb pain. Implications for research. Based on the appraisal of the articles, several recommendations can be proposed for future studies. Future studies could be improved by conducting higher quality studies using well-designed cohort studies or randomized controlled trials. Additionally, these studies could include larger sample sizes with more diverse populations. Lastly, standardization and consistency of data collection could help improve the overall quality of evidence. These are our references, and thank you for listening.